I want to talk about failed medical theories. For the thousands of years that people have been writing things down since written history, in the days of the pharaohs, thousands of years ago, there's thousands of failed medical theories every century, and the 20th and 21st century are no different. We have thousands of failed medical theories. Some of them are pretty costly in terms of human misery and death and money. Some of them are just a giggle. Let's look at some of the more egregious ones. The genetic theory. Let's start out with the genetic theory. Of course, doctors jumped on the genetic theory. Oh, this is the cause of all disease. And if we can figure out what bad gene causes disease, we can make a good gene in the laboratory, displace the bad gene, put the good gene in, and we'll all be cool. Well, that turns out to not be true. There's not a single disease that's caused by bad genes, and there's not a single birth defect that's caused by bad genes. All birth defects are caused by nutritional deficiencies of the embryo and early pregnancy during the formation period, the first 90 days, the first trimester of pregnancy. And most diseases that are not bacterial or viral or parasitic or trauma are actually caused by nutritional deficiencies, including ones that they propose that are genetically transmitted, such as type 2 diabetes, cancer, Alzheimer's disease, these types of things, is really, really very bad. So I want you to get a hold of 3 books here. The classic, Dead Doctors Don't Lie. This one just lays it out as directly, as strongly as I could get it. And then Epigenetics is kind of an add-on to Dead Doctors Don't Lie. Dead Doctors Don't Lie came out late 1990s, and, of course, it's been 20 years since. And the book, Epigenetics, The Death of the Genetic Theory of Disease Transmission, adds on to the body of evidence in the book Dead Doctors Don't Lie. So those 2 books are actually kind of a pair. Okay, Dead Doctors Don't Lie, the book, and Epigenetics, the book. Then Rare Earths and Cures goes into the chemistry and why we have so much nutritional deficiencies based on mineral deficiencies. Okay, 2/3 of the 90 essential nutrients, 60 of the 90 essential nutrients are minerals, so they are important. And some of them, like the rare earths, will actually double the lifespan of laboratory animals, and certainly the long-lived peoples have a lot of these rare earths in their soils where they grow their foods and get their wood supply and so forth for burning. And rare earths bin cures is really, really the good scientific thing. Goes into minerals, the different types of minerals, and why they're so essential for health and life. Again, Dead Doctors Don't Lie, the book, Epigenetics, the book, and Rare Earths bin Cures, the book. Now, let's see here. Let's look at things like obesity. Obesity, the big theory was that that's caused by eating too much and lack of exercise. Turns out it's a simple nutritional deficiency of one classification of nutrients, and there's a couple of those nutrients. If you're deficient in them, you're going to be a 400-pound, 600-pound, 800-pound person. And then there is Alzheimer's disease. Alzheimer's disease is certainly not genetic. It's not caused by too much aluminum in your diet. Right? There's some really bad stuff that they came out with. And then there's the saturated fat cholesterol causing heart disease. Congestive heart failure is a simple deficiency of a single vitamin. Cardiomyopathy heart disease is a deficiency of a single mineral. I've done 1,700 autopsies on kids that died of that one. It's a simple deficiency of a single mineral. Coronary artery disease has nothing to do with genetics, has nothing to do with saturated fat and cholesterol. Coronary artery disease and clogged arteries in your brain and your eyes and your kidneys are all caused by inflammation, caused by eating fried foods, processed meats, oils. And, of course, this whole thing about cholesterol and saturated fat was in the Mediterranean diet, being healthier for you, was a sales program, a sales, a sales plan by Procter & Gamble, the American Heart Association, to sell Crisco. There's never any evidence to show that cholesterol and saturated fat are the bad boys, but they were demonized by Procter & Gamble and the American Heart Association to sell Crisco. And, of course, Procter & Gamble gave the American Heart Association $1.7 million to endorse Crisco as a healthier way to cook and eat as opposed to lard, cream, and butter. And everybody jumped onto margarine, and we became one of the sickest nations on earth as a result. So the American Heart Association and Procter & Gamble should be held responsible for this. And let's see here again. I would talk about acid reflux. There is no such thing as acid reflux. It actually should be called lack of acid reflux, because when you have reflux, belching, burping, bloating, constipation, reflux, of course, this is caused by not enough stomach acid, so yeast and bacteria grow in your stomach. Instead of being sterile when there's enough acid, your stomach environment is sterile. Nothing grows in an acid environment. But you get up around 3 or 4 pH, you're moving towards 7, the neutral. yeast and bacteria begin to grow. And then when you consume carbohydrates and sugar, the yeast and bacteria will ferment this sugar and carbohydrates into gases and sugars and creates the symptoms of reflux. And doctors have it all wrong. Oh, no salt. Well, salt is the raw material to make stomach acid. So they created this whole thing of acid reflux by getting people to restrict salt, because high blood pressure has nothing to do with too much salt. High blood pressure is caused by nutritional deficiencies, particularly minerals. And, of course, kidney failure will contribute to that. And this is all reversible with nutritional changes, dietary changes, and some supplement programs. And so I want you to get a hold of your Longevity associate and get a hold of the book Dead Doctors Don't Lie, the book Epigenetics, and the book Rare Earth-Been Cures, and you will know more than the medical system, which doesn't take much. And we'll be back with more truth, justice, and the Longevity way. And Dead Doctors Don't Lie after these messages.
If you're the type of person who likes to volunteer and help others, this should interest you. What better way to help people than to help them overcome their health challenges? Longevity has been helping people overcome their health challenges for years. Our approach to health is drastically different than medical doctors who mostly only treat symptoms. As a veterinarian, Dr. Joel Wallach discovered that many common disease states are actually preventable and reversible. Our mission at Longevity is to educate Americans about their own health. If you like helping people, join us in our fight to save America. While you're helping people prevent and overcome health challenges, you will also be able to build a lucrative home-based business. So what are you waiting for? Come join us and help save America. If you've decided to join us, call your local Longevity associate to find out how you can arm yourself with the knowledge that's needed to save America.
Hey, if you're like me, your life is hectic. You don't know where you're going to be next. Between kids and family and in-laws and work and traffic and everything else that's driving me crazy right now, my life is insane. I bet your life's insane as well. When do we have time to get every single nutrient we need to be healthy? When? Well, I've got a tip for you. Take a product called Pollen Burst. It's so simple, even I can do it. All you have to do is open the package, pour it in water, mix it up, and bam, you're ready to go. It tastes great. It's not one of those medicine-tasting things. It tastes great, low in calories, helps curb your appetite, gives you natural energy that doesn't let you crash, gives you your vitamins, minerals, nutrients, everything from the plant world. And I got to tell you, for a busy person like me or a busy person like you, we need simple, we need good. Pollen Burst is your answer. Tastes great. Try it, and you'll feel better.
Call your local Longevity distributor to find out how Pollen Burst can make you feel better. And don't forget to ask about home-based business opportunities. When you perspire, working or playing, your body is losing more than just water. That's why it tastes salty. But what you're sweating out is more than just salt and potassium, as some sports drinks will have you believe. One of the most well-known sports drinks only has 2 nutrients, and it's loaded with sugar. Some have a mineral or 2 with a couple of vitamins. Longevity's exceptional sports drink, Rebound FX, is chock full of cancer-fighting antioxidants, a full spectrum of vitamins, plant-derived minerals, and herbs. Rebound FX is a highly absorbable liquid supplement that gives you quick, sustained energy. Rebound FX supports cardiovascular health, immune health, and boosts stamina and energy. Don't short yourself during and after your workout with just a couple of nutrients. Drink Longevity's Rebound FX for optimal health. If you'd like to learn more about nutritional supplementation, call your local Longevity associate, and don't forget to ask about home-based business opportunities.
Through his research as a veterinarian, Dr. Joel Wallach discovered that most health problems afflicting livestock can be prevented and even reversed. Many of these same health challenges also occur in humans. These too can be prevented and reversed. Doc's original formula, called the pig arthritis formula, alleviated all arthritis symptoms in animals. The same basic formula has been developed for humans, called the Pig Pack, which includes plant-derived minerals, a multiple vitamin complex, glucogel, and EFAs. Add to that Longevity's OsteoFX Plus, a proprietary blend of liquid calcium, magnesium, and glucosamine. Now you have the Pig Pack Plus to make up the 90 essential nutrients Dr. Wallach has identified as necessary for sustained good health and longevity. If you'd like to learn more about nutritional supplementation, call your local Longevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Hi, this is Dr. Joel Wallach, your host of Dead Doctors Don't Lie. If you're interested in a colon cleanse, blood cleanse, liver cleanse, in the classical herbal way, you want to ask your Youngevity associate for Herbal Rainforest. Herbal Rainforest has 16 herbs, 16 cleansing herbs, classic cleansing herbs, and 77 plant minerals. That's right, and these are all organic. It doesn't get any better than that. In your busy day, and you're around all these toxins out there in your workplace, on the way home, going to work, in your food, in the air, in the water, you need Herbal Rainforest. I guarantee you, it will give you a cleanse. You can control the dose. It's a liquid. It tastes good. It doesn't get any better than this. A colon that's happy makes you happy. Nothing better than a happy colon. Herbal Rainforest. Clean it out.
For more information on this product or others you've heard about on the Dead Doctors Don't Lie radio program, call your local Youngevity associate today. And don't forget to ask about home-based business opportunities.
Greetings, everyone. Judy DeVilbus here. What do you think of when you hear the words tangy tangerine? Well, I think of like a sweet, tangy tasting something. Well, what I'm referring to is the Ultimate Tangy Tangerine. It's a fantastic product. It has everything you need, and a great benefit is it's very, very delicious. It's very easy to drink. I've suggested it even to youngsters. Even children like it. Even little guys. Even little girls. They come right into my office. Their parents can't get them to take those chewable, and besides that, they're not as good as tangy tangerine. And I give them a little taste of that, and you know something? They're pleased as punch. So, if it's good for a child and it tastes delicious, why not you? There's no excuse not to take a vitamin when it tastes as good as that does. So how about it? Tangy tangerine should be the answer to all of your nutritional program problems.
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities.
Okay, Doug, what pearls of wisdom do you have for us?
Well, I thought we'd talk a bit about bariatric surgery and type 2 diabetes, as I have a Fox News story here headlined, Weight Loss Surgery Better Than Diet and Exercise in Treating Type 2 Diabetes, according to a study. So there's a growing body of evidence that suggests that weight loss surgery is more effective than diet and exercise in getting rid of type 2 diabetes. This was a small randomized trial published in the Journal of American Medical Association. Surgery provides the latest evidence showing the superiority of bariatric surgery over lifestyle changes in resolving chronic condition involving high blood sugar. In this trial of 61 obese adults with diabetes, they were randomly assigned to either one or two types of surgeries or intensive lifestyle intervention and followed for 3 years. 40% of those who got the gastric bypass and 29% of those that got the gastric band were considered in remission from diabetes and no longer needed to take medication after 3 years. And they say in comparison, no one in the group with the intensive lifestyle intervention resolved their diabetes. Obviously, they weren't taking any sweeties. And they go on to say one of the lead researchers here, Anita Korkulas, a head of minimally invasive bariatric and general surgery at the University of Pittsburgh School of Medicine, led this study, is quoted as saying, "I do think it adds strongly to the growing body of data that surgery should be considered to treat people with obesity and diabetes." And I found it interesting. Well, what do you expect a surgeon to say? They're not going to say go take some vitamins and minerals. They're going to, like you've often said, to a carpenter, everything looks like a nail, and they want to pound it in. With a surgery or with a surgeon, everything looks like surgery. They go on to say, however, they conclude that firmly that surgery is better option of data for more patients across different treatment centers, according to this Kakulis. And they go on to say American Diabetes Association lists surgery as one option in the 2015 Medical Care Guide for diabetic patients with body mass over 35. But, no mention on any kind of, lifestyle change like adding some nutrients to the body.
Well, you notice, Doug, and thank you for bringing this one up, you notice they're talking about the symptom of blood sugar. And blood sugar is not the disease. It's a symptom of the disease. It's just like a red warning light's not the cause of your engine burning up, but it's telling you there's a problem there with the heat in the engine. Same way with blood sugar. When it goes up, it tells you that something is going wrong with your cell membranes, with your metabolic system. And in the case of type 2 diabetes, which makes up 98% of the diabetic population, this is a cell wall problem, a communication between insulin, which your pancreas is making a lot of. People say, oh, yeah, my pancreas is dead. I got to use insulin now. No, your pancreas is making tons of insulin. It just is not working because your cells can't understand the language of insulin. So it's actually, we learned 70 years ago, a deficiency of a single mineral. And that's why we're so successful. We can make everybody's church a type 2 diabetes-free church in 2 months or less. We can make everybody's family type 2 diabetes-free in 2 months or less. We can make your state type 2 diabetes-free in 2 months or less. We can make America type 2 diabetes-free in 2 months or less. We can make the world type 2 diabetes-free in 2 months or less. It's a very, very simple thing to do. But, of course, the medical doctors, like surgeons, they want to do the surgery. They want to treat you for 25 years as opposed to getting rid of the problem. And once you know what the problem is, you can't unknow what you know. And so this is why we're so successful with type 2 diabetes. If you want to be an ex-diabetic, contact your Youngevity associate. Get a hold of that book, Hell's Kitchen. Of course, the subtitle is The Cause, Prevention, and Cure of Obesity, but it also goes on to say type 2 diabetes and the metabolic syndrome. It goes into all the physiology and how these nutritional deficiencies actually cause type 2 diabetes. And once you have that information, you're unstoppable. You'll be able to reverse it yourself. And the nice thing about it is it'll never come back as long as you stay in the 90 for Life program. It's an amazing thing. So thank you for bringing this one up, Doug. And don't forget that book, Hell's Kitchen, goes into type 2 diabetes and obesity and metabolic syndrome. We'll be back with Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to callers.
All right, let's head to Detroit, Michigan. And Anthony, you're on with Dr. Wallach.
Well, Anthony, you're on the air.
Hey, Doc. God bless you.
Well, thank you, sir. What's up?
Got two gentlemen I work with. One of them, son, is in the hospital with kidney problems. He's 6'1", 19 years old, and 170 pounds. He also told me that his mother that he lives with has asthma and restless leg syndrome. And,
okay,
but
he has asthma and restless leg, or his mother?
His mother.
Okay.
He only has kidney problems, and he's in the hospital this week.
Is he 19 years old?
19 years old.
Okay, and how tall is he, do you know?
6'1".
Okay, and does he have any other issues? Does he have any asthma? Has he had his appendix out, anything like that?
He didn't say. He just said that he had kidney problems and not really eating and...
Okay, and does he have type 2 diabetes or type 1 diabetes?
No, he didn't
say.
No.
Okay,
No.
All right. Okay, this is a Shar thing. Shar, mother's got asthma, This kid's got kidney problems, only 19 years old. What's going on here?
He's definitely got a gluten problem. There's no question about it.
Okay, and what causes kidney failure? There's usually nothing wrong with the kidney. What causes kidney failure when you have kidney failure?
The little afferent arteries that go into the kidney with the dirty blood are plugged up from eating margarine and burnt animal fat and salad oils and all the bad stuff.
Okay, you're exactly right. So, Char's exactly right here, Anthony. And so what would you give him?
I give him, if he doesn't have any other problems, I'd give him 2 healthy start packs, and I'd give him the Ultimate Daily for the kidney problem.
Okay, well, for the artery problems, right? Okay, very good. So Char gets an A+ there, and Anthony, I'd go ahead and give this young fella a change in diet, no fried foods, no processed meats with nitrates, nitrites, no deli slices, sandwich meats, absolutely no oils, no olive oil, coconut oil, margarine, mayonnaise, salad dressing, cooking oils, no gluten, no wheat, no barley, rye, no oats. And then I'd have him take, as Char says, 2 healthy start packs, something very basic, a full dose for everything at breakfast, full dose for everything at dinner time. And then I'd get him, start out with 1 bottle of Ultimate Dailies a month that allow him to have 3 of the Ultimate Dailies at breakfast and 3 at dinner time. And they're designed to support healthy blood pressure. They're also designed to support and promote healthy blood flow through obstructed arteries. That includes the brain, the eyes, the heart, and the kidney. It's not unusual for young people to get kidney failure, not because there's anything wrong with their kidney, but the little afferent arteries, as Char said, are being plugged because they eat so many fried foods and oxidized oils and so forth in their diet, and they're not taking any antioxidants to sort of neutralize that effect, and as a result, they need to work pretty hard here. Severe dietary change. Everybody in the household, including mom and dad and dog and cat and brother and sister, everybody from the same mother, all his brothers and sisters from the same mother, and she needs to go on a gluten-free diet, and all of her siblings need to be on a gluten-free diet. And wouldn't hurt to take the 90 essential nutrients, of course. And give us a call in a couple of weeks. Let us know how this guy's doing. We want to know his blood pressure. We want to know how his creatinine levels are doing, his glomerular filtration rate, and all that kind of stuff, because we should see some pretty quick resolution here. We'll be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to callers.
Let's head to Washington State. And David, you're on with Dr. Wallach.
Oh, David, you're on the air.
How you doing?
Yes, sir, very fine. How can I help you?
Yeah, I had a very interesting question. I love coffee a lot, and but every time I seem to drink it, I wind up getting all the symptoms of what maybe you call a bladder infection. And every time I back off of it, over the course of maybe a week or 10 days, I just go back to normal. And I don't believe in antibiotics unless I'm going to die.
Okay, now, when you say you get symptoms of a bladder infection, you're talking about burning on urination, or what are we talking about?
Yes, cloudy urine, bloaty, sort of a burn sensation, sort of having to have to go to the bathroom, but you don't really, a slight ache in the back of the kidney, sort of, you can't really tell where it's at.
Now, let me ask you a question here. Do you have any history of a back problem?
Not that I'm aware of.
Well, you don't necessarily have to have pain, but you can have noise. For instance, if you bend over, you get popping in your back, or you just, we wake up in the morning, you're one of these guys that have to kind of plant your legs and then kind of work your upper body to the right and then to the left and loosen your back up. Do you ever have any of that kind of stuff?
I used to a lot when I ate what I thought was maybe a sugar problem, because I don't eat sugar anymore, and I would always wake up with a horrible backache. And then when I went, but they said I had a little bit of arthritis in my lower back when I went to the chiropractor about 3 or 4 years ago. But since then...
Well, chiropractic can certainly relieve symptoms, but there's no minerals in chiropractic, and so you're not going to get a resolution of the actual cause of the discomfort and the pain. And so I believe what you're seeing is an exacerbation, and which means an aggravation of this back problem when you take coffee, because when you take coffee without supplementation, by diuresis, in other words, by peeing out a lot, you're going to reduce your mineral level in your body. And it's all kind of this sort of strange relationship between the back and the bladder because of the nerves that control the bladder for both pain sensations and motor functions of the bladder, doing its work, squeezing the urine out. These nerves originate as the inner branches of the spinal nerves coming out from between the lumbar vertebrae, okay? And so this is called a peripheral neuropathy. I've had women put on antibiotics for, 25 years because the doctor said they had UTIs, urinary tract infections. They're burning on urination all the time. You get them off of the offending whatever it is, and then you throw the 90 essential nutrients at them. They get better. How much do you weigh, David?
About 197, 195.
Okay. Do you have any other issues, any respiratory problems or constipation or diarrhea, irritable bowel syndrome, anything like that?
No, I noticed, I was told by my dentist that I had receding gum lines.
Okay. All right. Well, that's all related, actually. Okay, Shar, what would you do for this guy? He's got symptoms of a lower back problem through the peripheral neuropathy into his bladder. He's got receding gums, 195 pounds. What would you do for him?
I give him 2 healthy bone and joint packs.
2 healthy bone and joint packs, a full dose of everything twice a day except for the glucogel. Take 15 a day, 5 at breakfast, lunch, and dinner. Stay away from carbonated drinks, all the other bad stuff, and give us a call every couple of weeks, David, and we'll walk you through this. Oh, yeah, switch over to Java Fit Coffee. You'll be happier. Be back after these messages.
Let's head to Idaho, and Ann, you are on with Dr. Wallach.
So, Ann, you're on the air.
Hi, Dr. Wallach. I spoke with you, I think, in April. I was having some problems with fibroid tumors and endometriosis. And at that point, I was you asked me to call back when I got some results. And they did tell me there's no cancer, which is good news. Following your regimen, which you suggested all the 90 essential, but Women's FX, Ocean's Gold 3 times a day, and higher doses of EFAs, Xerafem, and also selenium. So I did that, plus all the antioxidants. And I wanted to know that because of that, the bleeding stopped on its own, which is great.
Yeah, it stopped without surgery, correct?
Correct. So,
okay, and how long did that take? Did it take you a couple of weeks or a month? Or
it took about a month. And then my doctor had given me a generic Provera to stop the bleeding, but I was able to stop taking that, and the bleeding stopped, and I actually had a normal menstrual cycle in between that time. And then there was a lot of periods of biopsies and things like that. I just got my last ones back, and they said they weren't cancerous. She said that my endometrial lining is 22 millimeters. It should be 14, and that there are 6 tumors, she said.
Yeah, well, these, of course, they use the word tumors. A tumor just means a swelling. Look up tumor, in the medical dictionary. It's a swelling. Could be an abscess. Could be this free radical damage, which they call fibroid tumors. And it's really just free radical damage to the smooth muscle. Remember, they keep telling you the biopsies are negative for cancer, yet they keep using the word tumor. Okay, and so it's not a cancer. Okay, and so basically what it is free radical damage. It's going to take, it might take 4 to 6 months to have your body slowly replace this damage, because that didn't happen overnight. And so you're looking for some, long-term rehab there of the uterine wall. But the fact that the symptoms, you've had a normal cycle in there, the bleeding has stopped, and what about the discomfort? Any reduction in pain and discomfort?
Yes, there has been, yeah.
Okay, good. So what I would do is just keep going the way you're going. Just keep going with the changes you've already made. Keep taking the supplement program, and then give us a call, every month, unless something unusual happens, and just give us a progress report, because I think it's going to take 4 to 6 months because in some cases, some of these fibroids are the size of a human fist, and they can be uncomfortable, and it takes a while for that to get resolved. It's not like it's going to happen in 2 weeks or something like that. But the fact that your symptoms have gotten dramatically better, sufficient enough that you're kind of raising your hands and, my gosh, this is doing some good, and I don't want to take any more medication. I don't want surgery. And, of course, I think you've chosen wisely, and we deal with this with a lot of women, and that's why we have these products. And as a practicing naturopathic physician for 12 years before I went totally 100% with the longevity program so I could help more people, I used to see women in my practice all the time for these gynecological problems, including endometriosis and fibroids, and we're using these old-timey herbal combinations for symptom relief. And then once I learned what the problem really was, then get the antioxidants in there, take the 90 essential nutrients, and just had remarkable positive results. And as a result, they would tell their girlfriends, and so I used to have a lot of lady patients with these kinds of things. So thank you for the testimony, and just give us a call every month or so. And obviously, if there's any question, anything pops up that might be a question, give us a call. Anytime you have another examination, give us a call back with the results, and we'll be happy to walk through this with you. But thank you so much for the positive testimony. Okay, Doug, let's go to callers.
All right, let's head to New York. And Mike, you're on with Dr. Wallach.
Hello, Mike, you're on the air.
Hello, I have a long list of things. Please
you have to speak up, Mike. I can hardly hear you. You have to speak up.
Yes, please. Can you hear me?
That's better. Mm-hmm.
Yeah, okay. I have sepsis, high blood pressure, low blood pressure. I had a heart attack, diabetes, congestive heart failure, missing teeth, cellulitis, ulcers of the calf, kind of deep, blood clot in the heart, blood clot in the left leg, low sodium, high potassium, edema from the waist down, urinary tract infection.
Okay, now stop there for a minute. How much do you weigh, Mike?
Yes.
How much do you weigh?
I weigh 250.
Okay, and how tall are you, sir?
5'5".
Okay. At 5'5", I'd like to see a guy weigh 150, maybe 150, so you're 100 pounds overweight. That'll certainly contribute to all this stuff. But do you ever have any respiratory problems, any asthma or bronchitis or COPD, anything like that?
Bronchitis when I was a kid.
Okay. And any skin problems, any eczema, dermatitis?
Yes.
Okay.
Yes.
All right.
Yes.
Shar, what's Mike's underlying problem here?
He's got a gluten intolerance. That's why he keeps getting these different things wrong with him all the time.
Exactly, and every one of them is either directly or indirectly due to a nutritional deficiency. These are all nutritional deficiency diseases and are subsequent to that. And so gluten intolerance, we got to get him off of gluten and all the other bad stuff, no fried foods, no processed meats, no deli slices, sandwich meat, sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky, no oils, no olive oil, coconut oil, margarine, mayonnaise, salad dressing, cooking oils, no gluten, no wheat, no barley, rye, oats. And then what would you give him? 250 pounds, what would you give him as a supplement program, Shar?
Well, ideally, he should have 3 healthy blood sugar packs, and then he needs to take some selenium in addition to that. And if he can't afford 3, he should take 2 for sure.
Okay, and what would you do for his weight?
Get him on the ASAP.
ASAP. Okay. Well, Char's completely correct here, Mike. What we need you to do is get up all the bad stuff, which includes the gluten. Everybody in the household, including the dog and the cat and spouse and mother-in-law and renter, and everybody's got to be gluten-free. No wheat, barley, rye, or oats. No wheat, barley, rye, and oats. And then you need 3, ideally, of the healthy blood sugar packs, and you take your fasting blood sugar every morning before you medicate yourself, because your blood sugar will drop. And then for the high blood pressure, what would you give him for the high blood pressure, Shar?
Ultimate Daily.
Very good, Ultimate Daily. You need about 9 of those tablets a day, maybe 12. Let's go with 12 Ultimate Daily tablets a day, 4 at breakfast, 4 at lunch, 4 at dinner. That'll be 2 bottles a month of the Ultimate Dailies, and they're designed to support and promote healthy blood pressure. And what would you do for his, he also had, let's see here, congestive heart failure. What would you give him for the congestive heart failure?
Oh, de-stress.
Absolutely, because de-stress has the vitamin in it that's deficient when you have congestive heart failure. So I'd also take 9 of the de-stress capsules a day, 3 at breakfast, 3 at lunch, 3 at dinner. I think that covers most of the territory there. Not all of it, but most of it. At least that'll get us a start. And then give us a call every couple of weeks. We want to know your blood pressure, your blood sugar levels, your weight. And then, of course, once you get 2 bottles a month of the ASAP, it's a dropper full, not a drop, but a dropper full on your tongue, 30 minutes for each meal, a dropper full on your tongue, 15 minutes for the meal. That'll take 2 bottles a month to pull that off. We want to know your weight, your blood pressure, and your blood sugar. Every 2 weeks, give us a call. We'll walk you through this, Mike. Sounds very simple, and we'll be able to resolve your problems. We'll be back with Dead Doctors Don't Lie for these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Young Jillian, 90 for Life Crusade. And Doug, let's go to callers.
All right, let's head to California. And Art, you're on with Dr. Wallach.
Hello, Art, you're on the air.
Hello, Doc Wallach.
Yes, sir. How can we help you?
Yes, sir. I have a veterinary question for you.
Okay.
My cat, 18 months, was diagnosed with a tumor on her hip, where she was vaccinated with rabies vaccine. It's a sarcoma developed, and I understand that certain vaccinations have what's called an adjuvanted vaccines. It contains substances designed to enhance the immune stimulation, and such as aluminum. And what developed in my cat was a tumor, so she had it surgically removed.
Okay. Was this a malignant tumor or benign tumor?
It was found to be benign.
Mm-hmm.
Excuse me, malignant.
Okay.
And it was removed, and I understand that most veterinary doctors stopped using this 10 years ago. And so the biopsy confirmed that it was a sarcoma. And so what I want to know, Doc, in order to prevent it from recurring again, they had to remove it and all the tissue around it. Is there anything else I can do on my behalf to make sure my cat doesn't have a recurrence of this sarcoma?
Sure. Okay, well, first of all, I'm going to do some research. It's a very interesting question. I personally don't have a lot of experience with the answer to that question, but what we can do for the cat, assuming the cat weighs about 8 pounds?
Yes, sir.
Okay. Shar, what basic supplement program would you give this cat? 8 pounds?
I give it Arthrodex.
Yeah, Arthrodex is 1 scoop per 25 pounds of body weight, and that'd be a little heavy here. I'd go ahead and give the cat a half a scoop in his food every day. I would also give it something like the Cell Shield RTQ. Go ahead and give it 1 capsule a day, open it up and dump the powder in his food. So let's start there. And make sure it's a canned food, absolutely no grains, none of the dry food with grains in it. It has to be a canned food that's a complete nutrition, all the vitamins and minerals in it. But that half a scoop of the Arthrodex every day, and then 1 of the Cell Shield RTQs, and let's start there. And I would like to have you get a hold of the copy of the histologist or the pathologist report on that tumor that was removed, and it should have a summary or an opinion or conclusion. The last paragraph, let's start out there. If you can get that last page of the records, and give us a call and let us know what it says. That'll be very useful, and that way I can do some research on it and be able to better answer the question. But this is what we're going to do to support the cat's immune system. One other thing, I'd go ahead and give it 1 of the Ocean's Gold tablets a day. Grind it up into powder between 2 spoons and dump that Ocean's Gold tablet powderized into the food. It's made the cat will love it. It's made out of all kinds of sea vegetables and so forth, so it has a little fishy odor to it. And let's start there, and in the meantime, I'll do some research on that, but thanks for bringing that up. Okay, Doug, how much time we have?
Just over 30 seconds.
Okay, over 30 seconds. So I'm going to go ahead and remind people to get a hold of the books Dead Doctors Don't Lie, the book Epigenetics, and the book Rare Earths Bin Cures, and that's going to cover the waterfront. That's going to teach you how to deal with all of these failed medical theories that the medical system has put Americans and the world through, and you'll be able to save people with the information of those 3 books. Okay, Dead Doctors Don't Lie, Epigenetics, and then of course the book Rare Earths Bin Cures. Those 3 books will give enough information to save your family, save your neighbors, save your church families, save your workmates and your neighbors and so forth. We got to go to work here. The medical system has failed us terribly, and they're more of a danger to us than ISIS, and so we have to really get to work here. Thank you so much, Shar. Super job as usual. Thank you, Doug and Richard. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs, and God bless America.
Hi everyone, Andy Anderson here. Are you using those handy little bottles of gel that zap germs, bacteria, and other nasties? In today's world, that's smart, especially with all the filthy doorknobs, shopping carts, and handrails we touch every day. Here's what you may not know. Once the alcohol evaporates, goodbye effectiveness. No more protection until you use it again. PureWorks to the rescue. Our FDA-compliant foam, lotion, soap, and spray do not rely on alcohol. Their killing power lasts up to 4 hours. PureWorks disinfecting spray is EPA certified to kill swine flu, bird flu, MRSA, HIV, hepatitis B and C, and a whole host of viruses and bacteria. Mold and fungus too. It's even safe around children and pets. You'll love the soft feel of PureWorks on your hand. It actually conditions and will not dry your skin. Here's a little peace of mind knowing your hands are still germ-free hours later. Get your hands on PureWorks and get PureWorks on your hands. Stand by. Pull out your paper and pencil for your local number to order PureWorks.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. 3463.
I am Judy DeVilbus. Here I am speaking to you again. I just wanted to tell you that recently I started drinking the Whey Shakes again, the chocolate Whey Shake. And you need to remember, the Whey Shake isn't just for losing weight. It's a fantastic place to get your great protein. And if you're trying to gain weight, you can take it along with your meals. And the best part is, if you want to just have a great protein shake, do like I do. Put it over ice, stir it up, and you can sip on it for 20 minutes to an hour. I do it every single day. I absolutely love it. You need to get back to it too. It's really good for you. And it makes not fat, but it makes muscle after you work out. And you can also mix it up in a blender with an egg, and you have the most incredible health protein shake. Or mix it with a little water, stir it up, and you have a little pudding. And who doesn't like pudding?
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities. Fish has been thought of as a brain food for eons, but it's not the fish that's key. It's actually the essential fatty acids, EFAs, or omega-3s found in fish, called essential because they're necessary for good health and your body can't make them. So they must be consumed through diet or supplementation. Youngevity has developed the perfect supplement in SmartFX, an acronym for Sustained Memory and Retrieval Time, a concentration of DHA and EPA, both members of the omega-3 family, supporting neural path function and cardiovascular health for optimal mental concentration, awareness, focus, and agility. If you've got a mentally demanding career, you're a student crunching for the big test, or just want to maintain health for a sense of well-being, try SmartFX from Youngevity. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
With increasing rates of osteoporosis, it's becoming more and more evident that most Americans have low blood levels of calcium. Some would say,
I get all the calcium I need from dairy products.
Unfortunately, that's just not true. Besides, most dairy products are homogenized and can contain steroids and antibiotics that kill off good bacteria in the digestive system. Not to mention, the human body needs magnesium to make use of dietary calcium. That's why Youngevity developed OsteoFX Plus, containing bioavailable plant-derived forms of vitamin D3, calcium, magnesium, zinc, copper, and glucosamine sulfate. OsteoFX Plus is formulated to support healthy bones and joints. Not to mention, OsteoFX Plus tastes great, unlike other products that taste like chalk or dirt. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.